right. All right. Hi, everybody. This is Dr. Moore with ND Direct Docs again, and we are back with our neighborhood pediatric ear, nose, throat specialist. I love it. And we have one of our very own. I like it. So this is Dr. DJ Trigg with Kids ENT of Indiana, and today I want to ask you about nosebleeds, especially in little kids, because gosh, I see this all the time in pediatrics. It's very concerning. My kid, either they woke up or they had a nosebleed and it was all over their pillow. It seems like so much blood. And understandably, it kind of freaks parents out. They oftentimes want to see a specialist. I try to provide some basic reassurance, but sometimes I'm sure they need to see you. And I do try to explain that even if they don't admit to it, all children pick their nose, which is one of the biggest categories of causes for this. And usually it's not as much blood as they think, but we're about to head into winter when it's really dry inside. And I don't know about you, but this is when I am about to hear about nosebleeds every other day. So let us know what you like to tell people about it.
Yeah. So I see a lot of kids for nosebleeds, and I'll be honest with you, the overwhelming majority of kids that I see, they're not doing something right, meaning that they're either not doing the right preventative techniques or they're not stopping the nosebleed. And so it's just really a lot of education. I almost never have to physically do anything. It's just educating. So the very first thing that I tell parents is that you have to understand that the nose is an air filter. Mm-hmm. It's an air filter for, in the front line of defense for your lungs. And to be a good air filter, it heats and humidifies air. But to do that really well, it needs a very rich blood supply. And so you have quite a few vessels that are sitting right underneath the skin inside the nose, the mucosa. Mm-hmm. And anything that disrupts that mucosa is going to result in a nosebleed. And so the two most common causes in kids, probably in adults too, is going to be dry air. And as you said, winter months, usually a huge uptick in nosebleeds. And then, shall we say, digital trauma. Okay, tissue goes inside the nose, and what that does is you can scrape the skin, and it doesn't really take much, and then you'll start getting a nosebleed. When it is fall and spring and allergies are spiking, that actually makes things worse, because anytime you have inflammation inside the nose, whether it's from an infection or a kick up in your allergies, that inflammation results in more blood vessels coming to the surface, and so you're more likely to get a nosebleed. And so knowing all those things, this is how we sort of gauge how do you prevent nosebleeds. So the real easy things are, if you've got allergies, make sure you're on an antihistamine to prevent that inflammatory process. Try not to get fingers and tissues inside the nose as best you can. And yes, I can't tell you how many times I've seen kids in the office and I ask, so do they do any nose picking? And the parents are like, oh, no. And I look over and the child's got their, they're up to their elbow in their nose. And I'm like, maybe they do, maybe they do. So doing their best, I'll look at fingernails, keep fingernails cut short. But the most basic, if I had to whittle it down to how do you prevent nosebleeds, one simple step is saline spray, saline spray, saline spray. If you're on it, do more of it. If you're not on it, then you need to start. Because what the saline does is that literally helps to moisturize the inside of the nose. And the inside of the nose is designed to be moist. When it dries out, that's when you're going to get crusting, boogers, as well as a much greater likelihood of getting a nosebleed. So every single patient I've ever told, when they start using it, be patient. It's going to take a little bit, but it really does work. Do it 2 to 3 times a day, couple of puffs in each nostril, and generic over-the-counter saline. You don't need irrigation. You don't need a neti pot. And I really actually don't encourage the gel that's out there, the air gel. No offense to the company, but it really doesn't work because you're actually trying to moisturize a very, very big area. And when you just try to apply gel in there, it really just gets in a very small area. So you want to get as much in there as you can. And the more the merrier, really. And it's just saline. Saline also has the wonderful aspect of cleaning the nose because, again, if you think of it as an air filter, you're less likely to have stuff that's going to catch hold and cause an infection or cause an inflammatory response. So these things help the nose secondarily to avoid a nosebleed, but it's just salt water. And so it's great. So that's the very basis. In the wintertime, a humidifier in the room, I think, is a great idea. You don't need ferns growing as a result of how much humidity you have. But you definitely need to tick up the humidity levels in Indiana at least, and that definitely helps in the wintertime. And then the final thing in terms of preventative, besides preventing allergies, keeping the nose moist, is right after I see patients, just for maybe a week or so, what I'll tell them is when the children are going to bed, take a little bit of Vaseline and apply it to the septum on either side, just at bedtime.
So to the middle part of the nose.
Yeah, just on the septum. So 99% of nosebleeds actually come from this area right here, right where the finger hits. And that's also where air tends to hit just as it enters the nose. And so it's just this bad combination.
It's not warm and humid yet because it hasn't gone in. Okay.
Right, exactly.
That makes sense.
So just a little bit of Vaseline on your finger and you apply that inside the nostril and do that at bedtime. That serves as a physical protectant while they're sleeping because keep in mind, while we're sleeping, we're not actively drinking water. And so our bodies inherently dehydrate a little bit. And so that makes matters worse. And kids have no idea what they're doing. And so in the middle of the night, they'll do one of these things. And that's why they wake up in the morning and they've got, it looks like some Halloween, freak show that the parents are like, oh my God, what happened? Yeah, it's just a nosebleed that occurred overnight and they're just wiping their face and, so a little bit of Vaseline, but only for a week or two. It is a petroleum-based product, so it can cause some inflammation over time. So you don't want to do that forever. But those are the most basic things. And the final thing actually also is avoid a nasal steroid while you're going through nosebleeds because nasal steroids can induce more nosebleeds. So they are important, they have their place, but you don't want to do it while you're getting a nosebleed. And if you happen to be on, start getting nosebleeds, stop it for a while and recover. But the saline. That's number one. And then the second thing is, what happens if you get a nosebleed? I see people applying pressure in all different kinds of places. And really the reality is if you get a nosebleed is don't panic because if everybody's freaking out, that increases blood pressure, it's going to be harder to stop. And you want to apply pressure on the soft part of the nose against the septum on both sides.
So I see a lot of tip here.
Right? Yeah, exactly, right here. Not on the transition between the cartilage and the bone, not on the bone. That literally does zero. But you want to apply pressure. Sit down, keep your head upright. You don't need to tilt your head back or tilt your head forward. You can put a towel if you'd like to. And apply pressure for about 10 minutes or so. And I got to tell you, 10 minutes of holding pressure in a child, I've done that on my son before. After about 45 seconds, I felt like I had been there for a year.
Yes.
Has he graduated from high school yet?
Yes. I pause for a second. There you go.
I tell parents to just maybe have them grab hold or they grab hold, sit down in front of the television, turn on a channel that's got commercials and watch it in between the commercials. That's probably the right length of time.
Okay.
Let go. Don't blow the clot out. Okay. Another common mistake is people are constantly blowing the clot out. No, that's actually a clot. It's there to stop the bleeding. So leave it be. It's going to dry. It's going to form a scab. And you want to use copious saline because a moist environment heals faster than a dry environment. So that's actually going to help tremendously. But I also tell parents that keep in mind that once it bleeds, until it heals, it's very likely to bleed again. Commonly, parents come in like, we got 3 nosebleeds in a row. That's pretty normal. Don't freak out, but do all these things. And over time, the number of nosebleeds is gonna go to the bottom. Having said that, there's a few things which definitely you need to always keep in the back of your mind as a physician. Number one is, do they have an underlying bleeding abnormality? That's something I always ask patients about. Do we have easy bruising, things like that? You do want to keep in mind that this is exceedingly rare, that there can be blood diseases that occur that nosebleeds are the very first thing you see. So if they're having this weird constellation of stuff going on, have an idea of sending off a CBC as a primary care physician.
So a blood count to check and make sure that they're not having any low platelets or low blood level. That makes sense.
Right. Or their white count isn't messed up in a weird way. That's the nosebleeds are indicative of something. The final thing is in teenage boys, there's a very rare benign tumor that manifests as repeated nosebleeds. So anytime I see a teenage male in the office, I'm going to put a camera in their nose to make sure they don't have this rare thing, which would be really bad for me to miss. So these things are incredibly rare. Nosebleeds are very common. They're very easy to prevent, but you got to do all these steps. And so for me as a specialist in this, this is what I'm educating patients about. I almost never have to cauterize. That's extremely
I was
rare.
going to ask you about that because occasionally we'll have someone say, well, they zapped the blood vessel in my nose. How do you decide when to do that?
Right, and that's an excellent question. So I always tell parents that, listen, do these things. And if in 2 months you're still having nosebleeds with the same frequency, come back and see me. I have never had anybody come back to see me. Maybe they didn't want to come back and see me. I don't know. But I think in almost every case, it stopped. The cases, if you're doing all these things correctly and you're still getting nosebleeds, number one is that, I'm going to look to see if there's a big blood vessel that I need to cauterize. But it's actually in children rare that you need to do that. Because when you do that, the problem is if you're not doing all these other things, the saline and the protection, you're going to end up with a bigger nosebleed area after you cauterize, because you're chemically destroying certain things. So they're going to reform blood vessels, but it's going to be in a much bigger area. So do all the simple protective things. It's a little bit more hands-on for the patient, but it really is tremendously helpful. And then, the other things I think about is if they have evidence of easy bleeding, I want them to go see a hematologist to make sure that, again, we're not missing some underlying bleeding abnormality.
That makes a lot of sense.
That is Nosebleeds 101. The real final part, sorry.
No.
I was like, hey, I got one more thing. The real final part is that, let's say you're holding pressure for 10 minutes, you let go, and the nose is still gushing out. Okay, that happens. And again, it's scary. The final thing to have in your armamentarium, so you want saline, you want some Vaseline, you want an antihistamine if you're on that. But the final thing to have at your humidifier is a medication called Afrin. Afrin is the brand name. The generic is called oxymetazoline. Mm-hmm. It's an over-the-counter medication. It's designed for sinusitis. The way Afrin really works is it constricts blood vessels. So I actually use Afrin in the nose when I'm doing sinus surgery on kids to decrease blood loss. So what I tell parents is that if the nose is bleeding, they're holding pressure for a good 10 minutes, they let go, it's still gushing out. Get the Afrin, do 1 squirt in a bleeding side and a non-bleeding side. Hold pressure for another 15 minutes or so. That stops the vast majority of nosebleeds. Okay. I can't tell you it stops every one of them, but it stops the vast majority. If it's still bleeding after that, that's probably when you need to go to the emergency room and get checked out, and they might need to put something inside the nose and go from there. But that's the only other thing to have in your medicine cabinet, like, oh, here's the Afrin, pinch, and it really does help.
Yeah, as a pediatrician, it's one of the things in our medicine cabinet for infrequent use, but it's there if we need it.
Right. Infrequent use, but it's a nice thing to have in an emergency.
Absolutely. I've had some parents ask me over the years, and maybe you can give me your input, when I talk about Vaseline or petroleum jelly, just inside the nose. Some parents do get concerned about the petroleum-based product. I like that you're saying only a week or two, so you're really preventing problems. Some parents have asked me if it's better to use like a water-based lubricant, like KY jelly or something like that in the nose. What's your experience?
I don't have necessarily I don't lean necessarily in one direction or the other. I think it's good to have that appropriate concern about Vaseline and the elements in there. Anything, at least in terms of overnight, anything that is going to really stay there for a good portion of the night and literally just serve as a physical protectant in that area. It really traps the moisture underneath. Mm-hmm. And so because it is effectively a waterproof product, you don't actually want the water actually physically escaping. So that's the whole point of it, is that it actually keeps the moisture underneath there so that it hydrates the inside of the septum right in that spot to allow it to heal. And so that's why I'd recommend that. Anything that's going to be an aqueous solution or something that is water soluble, it doesn't do that. I mean, it can be helpful, but maybe not quite as helpful as the Vaseline. Obviously, don't take 10 pounds of Vaseline and jam it into your face and inhale it. Not a good idea. But just a little tiny dab right in there just for a week or so. That's it. That's it. Nothing crazy.
That makes a lot of sense. And then the other thing that I always add is, as a pediatrician, I deal with a lot of humidifiers and infants and safety cautions. So you'll have to tell me if you kind of give these same recommendations, but I always recommend parents use a cool humidifier and not a heated one. We don't need burn.
So obviously, you know, with anything that's heated, you have to be careful of getting burned, of course. The other aspect, which is kind of interesting, is that I used to recommend just a humidifier, and my pediatric pulmonary colleagues were always recommending cool mist humidifiers. Mm-hmm. And I was like, what does that matter? And they finally showed me some articles, and nobody understands why. But it turns out with heated humidifiers, in kids who have mild to moderate asthma, it actually can increase their chances of having a kind of a reactive airway sort of event.
Okay. I did not know that.
Sense why? Maybe that the molecules are high energy or something. But yeah, so I ended up recommending just cool mist humidifiers, which it turns out are now sort of the norm.
Yes.
That expensive, but yeah, cool mist humidifier is a great idea.
Yeah, you can find them at all price points. I think we spent $30 when my kid was an infant, and it's the cool mist I usually have recommended because of safety reasons, but actually I love that I can now add that it's actually better for them too, because now people will listen to me. I just have a big problem if I can prevent a burn. They happen so quickly. It can happen to the best parents. You know, it can happen to me tomorrow. It happens.
Yeah.
But when it's something like that you brought in to help your kid and then you didn't realize the risk, it just, it's hard to live.
Oh, yeah, right.
And then the other thing, of course, I'm sure you tell parents the same thing, is making sure that you empty it out every night or every morning, dry it out completely, follow the I'm terrible at cleaning things, but keep these clean by instructions, because the last thing you want is humidifying mold all over your house. Right. I was kind of freaked out as a mom the first time I used the cool mist humidifier. I won't lie. I did not know that it would leave like a white powder on the furniture. That's actually normal, and it wipes off easily. It does not ruin anything. I walked in the morning and was like, what happened to the dresser?
No.
So it looked very nice, but I did not want it permanently on the dresser. So it was one more like tip that I leave parents so they don't panic, because stuff that I did as a mom that I realized they could ask.
I think also if you use filtered water or distilled water, it's much less likely for that to happen.
Yeah, absolutely. That helps.
The dust is just sort of the natural chemicals that are in the or nutrients, shall we say, in the tap water. But if you use tap water, it's okay. But you may find you need to clean the device annually with a descaler or something like that as well.
Especially with our hard water here in Indiana. Yeah, I don't have a water softener, so I'm not blessed with soft water. And the other thing, I'm sure, I don't see these as often, but I do see parents sometimes asking me about like Vicks VapoRub and things like that. And they'll be talking about the humidifiers. And I'm like, no, we don't need a medication and a humidifier.
Yeah.
It really is just the mist.
Right. Yeah. The less you have in the humidifier, the better. I think in I'll say in rare circumstances, Vicks is kind of helpful, but definitely not in a humidifier. And also, I've also had parents who mistook, they're like, oh, we have a dehumidifier in the room.
Yes.
No. That takes moisture out of the air. You want something that adds moisture to the air.
It's this fine balance of a certain amount of humidity. We have a humidifier in our house for the winter. We also used to have a dehumidifier because of the summer humidity and asthma and all of that. So it's a fine balance. You can get a humidity. It's very cheap. You can buy like a meter if you're really worried about it and you want to know as a parent. We got one like decades ago. I don't even know where it is. It's not really necessary, but you can if you want to know where it's at.
For my son, who one of my sons, we have a humidifier in his room. And we got something off Amazon. It was highly recommended. I think it was literally about $33. It actually monitors the humidity in the room on the humidifier, and so you can so that and I mean it's not expensive. It's very quiet. It holds a gallon or so of water. So it's kind of been the best combination for everything.
I like that. I don't think they had those back when I first bought my dehumidifier. Decades.
When I was in college, it was take a pan of water and put it on the radiator. got humidity in the air, so
I love it.
hating
Well,
myself here a little bit. So.
yeah, it happens. Thank you so much for all these tips. At least I think you've added a couple of tricks to my arsenal, and
Good.
it's excellent if I can go and say, I'm telling you, you don't need to see the ENT. I'm telling you everything he's going to say. Look, I have a video. He said it too.
I don't mind the business. Okay, I don't mind talking to people about that. But yeah, I mean, you look a lot better. So
it's nice to be able to stop it from happening. And it's also, I think, refreshing. A lot of times parents, when I do refer their children or people themselves to a surgery specialist, a lot of times they get scared that the first thing that person's going to want to do is cut on them, whether it's
right.
a hand specialist or an ear, nose, throat specialist. And maybe that's true with some specialties, I don't know, but I really think it's reassuring to have them hear how much time you spend educating people on how to avoid a procedure.
Yeah, there's a lot of stuff in ENT that is non-surgical. I mean, experts in one small area, and we do operate definitely, and sometimes that's really the most important thing, or that's the recommendation that we make. But there's a lot of stuff that we deal with that is non-surgical, and it's just educating people about, hey, don't use Q-tips, here's how to take care of your nose, nosebleeds, et cetera, et cetera. So,
I mean, Q-tips keep you in business, don't get me wrong, but we'd rather avoid it if we don't have to. I like it. Well, thank you so much for your time. I appreciate it,
no
as
problem.
always.
All right.
We'll see you next time.
Take care.
You too.